everybody, this is Dr. Terry Chen. I'm a chiropractor with Spine Care Chiropractic and I've been in practice for 8 years. Today I'm going to talk about this condition called spondylosis. Now, this might be quite a confusing word, but actually spondylosis or osteoarthritis or spinal degeneration, they more or less mean the same thing. So I'm going to try to explain this so that you have a better understanding about this word which might be a little bit confusing for some people. So let's get right to it. Now, if you see over here, this is your lower back spine. Now, in the lower back spine, for a normal spine, first thing you see is your bones. So the bones should be like ice cubes and square. Is the white color structure. This is the bones, okay? And then in between the two bones you have the disc. So a healthy disc should be nice and thick, okay? And then the healthy bone should be smooth and square. And behind the disc and the bones you have this yellow structure over here. This is your spinal cord, and then this is your nerves that comes out from the spine. This is what a healthy spine looks like. And in a healthy spine you have a curve like this. So you have a curve something like this, okay? Now, what happens is as you age, the spine can decay. So when I say the spine decay, think about like tooth decay. You know, your teeth is white color and then it becomes yellow and becomes orangey and then it starts to decay and then you start to get cavities and so on and so forth. So actually all joints can decay, even your spine. So what happens when your spine decay is basically this is what happens. So I'm going to play in slow motion. So what happens is that number one, the disc becomes thinner and thinner. Number two, the curve of the spine changes. See, the spine becomes straighter now. And then what happens is the disc will start to pinch the nerves at the back of the spine, which can cause pain. So spondylosis potentially may cause pain. And what happens is as we progress, you can see that the disc decays more and more and more and becomes thinner. And then over time, instead of a smooth bone like this, what you will see is the bone becomes rough at the joints, okay? And then it forms like sharp edges at the front, sometimes on the side, sometimes on the back. Now these are called bone spurs. And as it deteriorates, it just gets worse and worse and worse. And the disc becomes thinner, you might get more bone spurs. And then the disc and a few ligaments at the back might be pinching and poking on the nerve at the back. So potentially spondylosis or osteoarthritis or spinal degeneration might result in a painful symptom for the patient. Now, this is also the same for the neck. So let's start from the beginning. If you look at the beginning, at the start, the neck, a healthy neck looks something like this. Again, you should have a curve something like this. So actually you can see this on the x-ray as well. So you should have a curve, like a C-shaped curve like this for a healthy neck. So what happens is as the spine decays over time, you can see the changes in the x-ray and in the animation as well. So you can see as I go through in slow motion, number one, you can see that the neck, it starts to straighten. So this is quite common among people today, even young people, because of our lifestyle today. You know, we look at computers too much, handphone, tablets, we look at books, reading and all that. So we look down all the time. So it starts to straighten, and then over time what will happen is you can see the disc, again the disc becomes thinner and thinner, and then it starts to poke and pinch the nerves that is at the back of your spine. So when it touches and pinches the nerve, then this may result in pain. And what happens is as it goes more and more, your neck curves more and more. And then you notice that over here you start to get the sharp edges, the bones that are, so let me just go back, the bones that are very smooth here, over here they become very sharp. So this is called bone spurs. So in a nutshell, this is how our spine decays over time as we age. And this is what it means when people say you have spinal degeneration or osteoarthritis or spondylosis. To show you an example on the x-ray, okay, so this is a normal x-ray of a lower back. So you can see, again, the bones that are normal should be squared and smooth, kind of like an ice cube. And then in between the two bones, you should see a disc. So the disc on the x-ray looks dark and it looks thick. And behind, you should have a big hole for the nerves to come out. Now, if you look on the right, you can see that instead of a smooth square bone, you have this sharp edge over here. So these are extra bones. This looks like the bull horns, and basically they are bone spurs. So this is called arthritis. And then if you compare this space to this space, you can see that this space is actually narrower. So the disc is actually narrower. And then behind here, you can see that the hole is very big. Now the hole here is very small. So this is what happens on the x-ray when you have spondylosis or osteoarthritis. Now, when this happens, some people, you might not have pain, but a big majority of people, they might have pain, they might have back pain, they might have buttock pain, they might have leg pain, they might have numbness, pins and needles and tingling down the legs, or they might have weakness in the legs, or they might have all of the above symptoms that I just mentioned in combination. So this is what happens in your lower back when you have spondylosis or osteoarthritis. Now, if you look at the neck, this is an x-ray of a normal neck on the left. This is the x-ray of a neck on the right with spondylosis and osteoarthritis. So first thing, when we look on the x-ray on the left, this is the normal x-ray. Again, you see that C-shaped curve in your neck. Everybody should have a curve like this if your neck is normal. And then the bones should be kind of square, that looks like ice cubes, and it should be smooth. And then the space between the two bones, you should have a black color space, which is your disc. It should be nice and thick. Now, if you look at the picture on the right, you can see that the spine becomes very straight. So this is no good. And then you see this sharp edge over here. So this is called the bone spur. Again, over here. You don't see the bone spur over here. Okay? So this is called arthritis. And then the thick space in between, this is the normal disc. If you look between these two bones, this is very thin and this is very thin. So for someone with spondylosis or osteoarthritis in the neck, it can result in symptoms like neck pain, pain in your shoulders, pain in your hands, numbness in your hands, pins and needles in your hands, weakness in your hands, and headaches. Or you can have a combination of all the symptoms that I've just mentioned before. Now, this condition is quite common in the population, and as a chiropractor, we treat these kinds of conditions almost every day. So in a future video, I will talk about how chiropractic treatment can help patients with spondylosis and osteoarthritis. So for today, I hope this has given you a better understanding of this condition. Sometimes it can be quite confusing because they have so many different words, but actually they all more or less mean the same. Spondylosis, osteoarthritis, spinal degeneration. Basically, it means that your spine decay over time. Just like how your teeth, if you don't brush your teeth and look after your teeth properly, it will decay. So same thing, your spine, when you don't look after your spine properly, it will decay as well. So as chiropractors, we want to look after the spine so that we can slow down or even potentially prevent this from happening. So I hope this has been beneficial for you. Thank you for watching, and if you like this video, please share it with your friends. If you would like to be updated when we release our next video, please like our Facebook page and click subscribe on YouTube. Take care and see you next time. Bye bye.